So in this module, we're going to have a look at putting our casualty into the recovery position. So when am I going to utilise the recovery position? Well, the recovery position is going to be used if my casualty is not responsive, aka they're not able to respond to my verbal commands or my hands, but I am satisfied with their breathing. So the first thing that I need to do is obviously make sure that my surrounding area is safe. Am I in danger? Is something likely to happen to me? Are there further dangers to anybody else? I'm then going to try to get my response from the casualty that we've just spoken about. I'm going to open the casualty's airway, look, listen and feel for that breathing for 10 seconds. Okay, in this instance, I am satisfied with the breathing. Well, first of all, that's a very good sign. But there is clearly a problem because they're not responding to me. So what I need to do is get the casualty off of their back and onto their side. So very carefully, with the hand that's nearest to me, I'm going to raise it up at a 90-degree angle. I'm then very gently going to lift up the casualty's leg at the knee joint of the leg furthest away so that the foot is flat on the floor. What I need to do is make sure that I keep a hand supporting this knee, because if they are unresponsive and I let go, the knee could flop down. This could cause further injuries. So make sure that I support that knee. I want to reach across and delicately grab the casualty's hand that's furthest away and bring it across and over to the cheek that's nearest to me. Now, using the knee as a lever and the back of the casualty's shoulders for a bit of support, I'm going to very gently roll them towards me onto their side. What I want to make sure that I've done when I've rolled them across is just readjust the casualty's airway, make sure that it is open, and every 60 seconds, for 10 seconds, I want to check the breathing. If I'm satisfied with the breathing, they can remain on their side. If I'm less than happy with that breathing, ideally I want the casualty back onto their back, fully open the airway, and reassess that breathing for 10 seconds. If once again I'm satisfied with the breathing, back into the recovery position they will go. If I'm not, then I will at this point commence CPR. So what are the benefits of the recovery position? Well, it's a steady position. The centre of gravity has shifted. From this position, the casualty is highly unlikely to flop back onto their back. It is a recognised first aid position. It helps to maintain an open airway. Whilst the casualty is on their side, the tongue is partly unobscured from the back of the throat, allowing for a reasonable airflow. Bodily fluids can drain. If my casualty is unresponsive and they're on their back and they were to vomit, this is going to close off the airway and cause me significant problems. If they're on their side, bodily fluids can drain away. This also is an easy and comfortable position for your casualty in terms of breathing. If they're on their front or they're on their back, then gravity is going to have a detrimental effect on their ability to breathe clearly, whereas if they're on their side, there's no obstruction to the chest, they're able to take in breath nice and easily.